but everything went well. We're going to talk a lot about the procedure and things like that. What we don't want to get too far away from is that he's had major surgery of his knee and that he's eating and drinking and pooping and peeing and all those things. If he's very painful, we want to make sure that we adjust the pain meds. If he's too painful, you'll see that he is guarding his leg when you're trying to clean the incision and things like that. He won't be eating very well, so we'd want to start some of these pain meds sooner. If he's really sedate, he's not really responding, he's just very relaxed, he doesn't care that you're messing with his leg at all, that's probably a little bit too sedate, and we might want to adjust his pain meds on the downside. Right now he's got a pain patch on. It's a fentanyl patch on the under the bandage of the non-surgery leg, and so we would have the opportunity, if he's too sedate, to remove that patch earlier than the 72 hours. So that's just the overall thing. We're going to talk a lot about the leg, but we just want to make sure he's comfortable in the next few days. We'll go through the medications. We are going to put him on some tramadol for pain, but that is, again, sometimes people don't need that until the pain patch is removed after 3 days from yesterday. So I'll show you some pictures of the procedure. This is his preoperative film, okay, and in this view you're looking at the knee from the side, and basically what the TPLO is doing is we are trying to manipulate that tibial plateau angle, which you can see is kind of downhill, where the ball of the femur here is resting right on it only rests on that portion of the joint right there. That's the cartilage covered surface. We can tell when we're measuring that angle right there is 62 degrees. Ultimately, that's what we're doing with the procedure, is trying to manipulate that angle to be more of at a right angle with the vertical axis here, which is the weight-bearing axis of the tibia. Again, I'll use my hands here. The whole idea is that the ACL used to make that ball of the femur, and this is the depiction of that tibial plateau. With the ACL, it used to prevent this type of sliding motion. And that's the only thing in the knee that prevents that ball from sliding down that hill. Once they've ruptured that ligament, which his was, it slips every time he puts the foot down. So the idea of the TPLO is, why are we fighting against gravity? And if we put a prosthetic or a graft or something in there and they're using it every step, it just fails. So for dogs, they can't fix it like they do in humans. So somebody came up with the idea of, why are we fighting gravity? Why don't we level this tibial plateau out, so when they step down, it can't slide uphill. So technically, that's all we're trying to do, is manipulate that angle, and we do that by making a cut in the tibial bone below the joint, so we're not going through any of the joint structures here. This is just free bone out here, and we make a cut along that arc, and we have a choice of blades. So we are going to cut that, release that whole bone there, and rotate it counterclockwise in a specific distance that will manipulate that angle basically to between 85 and 90 degrees. So in the next picture, it's the post-operative picture that shows exactly that. So we've made a cut along that line. We've taken that whole chunk and we've rotated it, so that point right there used to be up there, and we've got some overhang. His was 1.3 centimeters or 13 millimeters of movement, and then you can see with those same lines drawn on the plateau and the weight-bearing axis, we're now at 89.7 degrees. So these lines are now perpendicular. This bone plate is on there to allow this to heal, so that bone will heal back together and fuse back together. So the plate is temporary, but yet we don't usually have to take it out unless they reject it. But actually in 6 to 8 weeks, we would be free to take this out and it will not undo the fix. This is happening at the lower leg, on the inside of the tibia, so the knee joint is here. This is all happening on the lower leg bone on the inside of the leg. So this is a view, from the side. The next view is the view from front to back, and it'll show the length of the screws and what we have going on there. So that is the product. in this view, we're just making sure that none of these screws are in the joint. We're also making sure that this chunk of bone that we released did not shift either to the inside or the outside. But this gives a good view of the plate, and that he's got 5 screws there and 5 screws up in that chunk. So it's very, very solid. At this view, you know, we've made the cut from the top and then it kind of comes at us. So in this view, this is the only portion of the cut that we can see is the one kind of coming at us in that plane. So that is basically what we did. I'll kind of go over the discharge instructions now. And the top part of the discharge instructions is just describing what I kind of described is the theory and what we did to accomplish the TPLO, which is we cut the bone, and then we now need to allow that bone to heal in 6 weeks. Bone will only heal in 6 weeks. There's nothing we can do to make it heal any quicker than that. So that's going to be important as to the activity restriction. We can read through the activity restriction. The main take home of the activity restriction is that we don't want him to do any explosive movements or any quick movements. Him walking around the house, putting the foot down, putting the leg down, using it is not the problem. And so he can walk around the house. He doesn't need to be kennelled. If he's acting, crazy and running around, sometimes they do need to be kennelled to restrict their movement. But we do want him actually to be moving the knee daily and using it if he wants to. There is a section here that shows a graduation of how much activity he should have per day. And each week we can allow him to have more time per day. So basically the first week, going outside, going to the bathroom, coming back inside, doing that 3 or 4 times a day is just fine. And that's probably about what he's going to be up for. Week by week, you're going to add 5 minutes. So the second week, you're going to go 10 minutes. The third week, 15 minutes. So as it goes up, you're going to allow him more leash level activity outside where you can actually take him for a short walk. That does 2 things. One is it gets him a little bit more not bored, okay, during the recovery. He's going to maybe get a little bit bored. The other thing is week by week, you'll be able to assess, is he using the leg more and more? With that plate structure, it is very rigid. So that's the whole problem with this procedure, if you can call it a problem, is that he will probably be wanting to use the leg a lot more than we want him to be using the leg, probably around that 3 or 4 week mark. We do not want to allow him to do whatever he wants, because he may be wanting to overdo it when we know that bone is not healed yet. And that becomes kind of the hard part, is that he's not going to be a painful dog for 6 weeks. He's going to be painful for the first week maybe, and then it's going to subside a lot into him thinking that it does not slip, it doesn't hurt like it used to, and it's going to be harder to keep him from doing things that we don't want him to do. So we can use other medications, we can use sedatives, we can use whatever we need to try to help you out there if need be. Just give us a call and we can call something in if he is just so rambunctious and we really can't keep him down. So down here to this section is the medications. He's got the fentanyl patch on his the opposite leg that we did surgery on. There is a bandage on that. That's the only bandage he has on his leg, and that's only to cover the pain patch. The pain patch can come off 72 hours after surgery. You're just going to unwrap the bandage and remove that pain patch. If he's overly painful in those first 3 days, you can use the tramadol or gabapentin. In his case, it's tramadol. So even tonight, tomorrow, you can give him tramadol if he's having a hard time settling down, if he's acting painful. But a lot of dogs will not need that until after the pain patch comes off, 3 days after surgery. Other medications that he's going to be on, carprofen, same thing as Rimadyl. That's the anti-inflammatory. I'd expect him to be on that for 2 to 3 weeks. And you should always have a little bit left over for recovery. If he gets sore or anything, you can use that as needed after that 2 to 3 weeks. The cefpoxetine is an antibiotic. You're going to give that once a day, and you'll want to finish that medication out. So those are the 3 meds that he's going to be on: the anti-inflammatory, the antibiotic, and then to use the pain meds as needed. The more crazy he is, the more he's running around, the more he's showing no signs of pain or reluctance to use the leg, you can take him off of the pain meds. We don't mind if he has a little bit of a reminder during the recovery of a reason not to fully use the leg. That's helpful. So that's the first one that you're going to stop. As far as rechecks go, he doesn't have any external stitches. His incision is on the inside of the leg, but there are no external stitches in his incision. So we do not need to see him back at 2 weeks. If there's any problems with the incision, it's red, it's painful, it's leaking any fluid after a few days, he's, any smell or any major discharge, you can always give us a phone call about that or send us a picture and we can give you an idea of what to do. Since he's on the antibiotic, that's very rare, and usually the only problems we have with the incision is the dog licking it. So we'll want to have him in a cone, basically a cone until he doesn't lick anymore. That's usually about 10 days. I tell people to be as strict as you can with the cone so he doesn't get in the habit of licking. And use a warm compress to clean the incision twice a day. So just hold a warm compress over it, clean all of any sticky, gunky stuff that's building up around the incision. And by cleaning that up, maybe he licks at it, but he doesn't get that satisfaction of wanting to clean it himself. So at 6 weeks, we recommend to have him either back here or at your usual vet for x-rays. We're gonna check that same cut surface and see that it is fused back together. It should just fuse together. There shouldn't be much activity around that osteotomy or the cut bone. With the way that the plate works, it squeezes it together, so it should just fuse without creating much bony changes around it. So at that time, if it looks good, we're moving much more into the rehab phase or the physical therapy phase, where we are wanting to build him up over the next 4 weeks, where we're taking him on longer and longer walks. I usually use about 3 days as my time, so I might walk him for a half mile 3 days in a row, see that he's accepting that, see that he wants to go more, and then I build on that every 3 days. So maybe go from a half a mile to then a mile, and then from a mile to a mile and a half. But we're basically wanting him to get his steps in, so he's building up muscle. A lot of these muscles have shrunk down and atrophied. We want him to build up that muscle over time, so it's kind of what our doctors would tell us as just getting our steps in, low impact steps. Swimming is a great exercise. A lot of people don't have access to that, but we're wanting to do the lowest impact exercise, but him repeatedly moving it and using the leg to build up that muscle. That'll happen over the next month after that first initial week. So at the end of that, he can start doing more challenging things, jogging, going up and down stairs. You're really wanting to challenge him at the end of that 4 weeks, because the next step after that is him to just be off the leash and doing whatever he wants to do. If you're nervous about taking the leash off and you're worried about that, that often means that you haven't challenged him enough to show for him to show you that he's good on the leg and he's confident in it and he's not having setbacks at that time. So the next section is incision care. We kind of talked about that. It's just making sure the incision is clean and watching that. You can do warm compress, like I said, to help keep it clean. And there's usually not much issue with any incisions except for trying to get the dog not to lick. Special instructions, this has to do with warm and cold compress. You're going to view the swelling of the leg is going to be reflected in the lower leg. So down at his ankle or his foot, if you notice a lot of swelling there, we would recommend for people to use warm and cold compress around the knee, kind of around the incision area. And this section explains how to do both warm and cold compress. This is not doing anything for bone healing or any of the plate or anything like that. It's just for soft tissue swelling. So if I look at a dog and his ankle on the surgery leg is about the same size as the ankle on the non-surgery leg, I really don't recommend to do any warm and cold compress. The more movement and the more he's moving around and using that leg in the first 3 days, the more you'd expect to have his leg swell, and then therefore you might need to do some warm and cold compress. Certainly if it looks really big like a sausage leg and it looks uncomfortable, we're going to have you do massage of the bottom leg, ice and warm and cold compress on the knee itself, and then do a lot of range of motion and just massaging the lower leg to try to get that fluid back in, just to provide him a little bit of pain relief. If he's really good and not moving around a whole lot in the first 3 days, it's very often that people do not need to do the warm and cold compress. The last section here is plate removal. Most dogs do not require the plate to be removed. It's about a 5% chance of the body rejecting the plate at any time, or if infection finds the plate from a bad tooth or an infection or an abscess somewhere, and he does get that plate infected in the future, we would recommend to take it out. Like I said, 95% of the time, dogs just live with the plate in the leg and it doesn't cause any problems. It's very obvious when they're having a problem with it, because they will start licking at the lower inside part of their leg, and there might be even draining tracts or a wound that won't heal. We know right away that those dogs are having plate rejection, and we just take the plate out. So that's pretty much it. Give us a call if you have any questions or concern. And